1 in every 4 people alive right now will have a stroke in their lifetime. Let that number settle for a moment. Not 1 in 100, not 1 in 50, 1 in 4. And here's what makes this statistic terrifying. In the vast majority of cases, and we're talking upwards of 80%, a stroke doesn't ambush you without warning. It whispers. It knocks on the door of your body the day before, sometimes the week before, with signals so quiet, so easy to dismiss that most people wave them off as stress or tiredness or age. They call it a silent warning. I call it a scream that the medical system has taught you not to hear. A 47-year-old woman wakes up and notices her right hand feels a little clumsy, making her morning coffee. She spills some. She thinks, I didn't sleep well. By that evening, she's in an ambulance. A 61-year-old man experiences a few seconds where his vision goes double, then comes back. He thinks, I need new glasses. 3 days later, he can't speak. These are not rare stories. These are Tuesday mornings in emergency rooms across the world, and I've seen them more times than I care to count in 15 years of clinical practice. Today, I'm going to give you the physiological blueprint of what is happening inside the brain and the vascular system in the 12 to 24 hours before a major stroke event. I'm going to explain the signals your body sends that nobody, and I mean nobody, has properly taught you to read. And I'm going to give you a real, actionable protocol you can start tonight. Stay with me. This may be the most important video you watch this year. Now, before we go any further, I need to say something that some of my colleagues will not be happy about. Nobody in a white coat is going to tell you this. Not because they don't care. Most doctors are good, overworked people doing their best in an impossible system. But the healthcare model, particularly in the West, is architected around acute intervention, not anticipatory prevention. There is no billing code for taught patient to recognize pre-stroke neurological symptoms. There is no reimbursement pathway for explained endothelial dysfunction over 20 minutes in clinic. There is, however, a very robust billing system for the CT scan after the stroke, for the ICU bed, for the TPA clot-busting medication, for the months of rehabilitation. A single stroke hospitalization can cost between $20,000 and $200,000, depending on severity. The system profits from treatment. I profit from you not needing me anymore. That's my entire philosophy. And it's why I make these videos. This is not a cardiovascular problem, it's a systemic information problem. The information that could prevent strokes is available. It lives in peer-reviewed journals, in hemodynamics research, in the clinical neurology literature. It just never makes it to you, the person sitting in the waiting room for 11 minutes once a year. That changes today. Before we dive into the biology, and we're going to go deep today, all the way down to the cellular level, I want to ask you for one small thing. If you are not yet subscribed to this channel, please do that right now. We are on the verge of hitting 100,000 subscribers, and every single one of those numbers represents a real human being who now has access to this kind of information. That matters to me enormously. Hit the like button as well. It signals to the algorithm that this content is worth spreading, which means it reaches someone who needs it before it's too late for them. You may never know whose life you just helped save by clicking that button. But I believe the ripple effects of sharing real health education are profound. Now, let's talk about your brain. To understand why a stroke announces itself the day before it happens, you first need to understand what a stroke actually is at the cellular and vascular level. Because what most people picture is a cartoon. Reality is far more nuanced and far more preventable. A stroke occurs when blood supply to a region of brain tissue is interrupted. There are two primary types: ischemic stroke, which accounts for roughly 87% of all cases and is caused by a blocked artery, and hemorrhagic stroke, caused by a ruptured blood vessel. Today, we're focused primarily on ischemic stroke, because it is the one most reliably preceded by warning symptoms. Here's the key. Ischemic strokes don't usually happen in one catastrophic moment. They happen at the end of a cascade that starts hours, days, sometimes weeks earlier. Your blood vessels are not simple hollow tubes, they are living organs. The inner lining of every blood vessel in your body is called the endothelium, a single-cell thick layer of specialized cells that regulate vascular tone, clotting, inflammation, and blood flow. Think of the endothelium as the intelligent skin of your circulatory system. When the endothelium is healthy, it produces nitric oxide, NO, which keeps vessels relaxed and flexible. It actively prevents platelets, the sticky blood cells involved in clotting, from adhering to its surface. It is in essence a continuous non-stick coating on the inside of your arteries. When the endothelium becomes dysfunctional, like through chronic hypertension, oxidative stress, inflammatory cytokines, or lipid oxidation, it stops producing adequate nitric oxide. The vessel walls stiffen, platelets begin to stick, inflammatory monocytes begin to infiltrate the subendothelial space, plaques begin to form. This is called endothelial dysfunction, and this is not a theory. It is a documented physiological reality measured in thousands of clinical studies using flow-mediated dilation, FMD testing. Most ischemic strokes are caused by thromboembolism. A clot forms somewhere, usually on a vulnerable plaque in a carotid artery or in the heart in the case of atrial fibrillation, and a fragment breaks off and lodges in a smaller cerebral artery. But here is the key insight. Before the major clot forms, the body almost always experiences what we call transient ischemic attacks, TIAs, or in milder cases, subclinical microischemic events. In these moments, tiny clots temporarily block blood flow to a small area of brain tissue, cause symptoms, and then dissolve on their own. This is you drinking through your legs while your brain is begging for water. The blood is there, the heart is beating, but the flow to critical neural tissue is stuttering, choking, episodically interrupted. The symptoms of these TIAs, these warning strokes, are specific, brief, and terrifyingly easy to dismiss. They include sudden numbness or weakness, especially on one side of the face, arm, or leg. This lasts minutes, not hours, and then resolves. It's easy to think it was just nothing. Sudden confusion, trouble speaking, or difficulty understanding language. A person might say the wrong word, lose their train of thought mid-sentence, or feel suddenly disoriented. It passes. They forget about it. Sudden visual disturbance, blurred vision in one eye, double vision, or a brief curtain coming down over a part of the visual field. A phenomenon called amaurosis fugax, caused by temporary ischemia in the retinal artery. Sudden, severe headache with no known cause, particularly at the back of the head. This can indicate early vascular spasm. Sudden dizziness, loss of balance, or unexplained loss of coordination. These symptoms can last as little as 30 seconds. They almost always self-resolve. And in 10 to 15% of cases, they are followed by a full stroke within 48 hours. There's another layer to this that most people never hear about. Inside your brain's neurons, the cells that think, feel, and control every function of your body, are mitochondria, the organelles responsible for producing ATP, your cellular energy currency. Under ischemic stress, when blood supply is reduced even transiently, mitochondrial function begins to deteriorate. Neurons begin to struggle. They can't maintain their membrane potentials properly. Ion pumps fail, calcium floods the intracellular space. This process, called excitotoxicity, begins to damage neurons even before a full stroke occurs. And here is the insidious part. The brain is enormously adaptable. It compensates, it reroutes, it masks the dysfunction from conscious awareness for as long as it possibly can. By the time you feel something is wrong, the process has often been underway for hours. Emerging research in the field of neuroimmunology is revealing something remarkable. The vagus nerve, the longest cranial nerve in the body, the superhighway between your brain and your gut and your heart, plays a significant regulatory role in cerebrovascular inflammation. Chronic low vagal tone, which is associated with poor sleep, chronic stress, sedentary behavior, and a dysbiotic gut microbiome, correlates with higher levels of systemic inflammatory markers like IL-6 and TNF-alpha. These cytokines accelerate endothelial dysfunction and promote the formation of vulnerable plaques. In short, your gut health, your sleep quality, your stress physiology, and your stroke risk are all connected through one extraordinary nerve. The brain is not an island. It is downstream of everything else in your body. Now let me stop and address something I see constantly, both in patient consultations and spreading all over health forums online. The myth. If you're having a stroke, you'll know it immediately. It's obvious. You'll collapse or lose consciousness. This is clinically false, and this myth kills people. The Hollywood portrayal of a stroke, person suddenly grabbing their head, falling dramatically, face drooping immediately, represents the most severe end of a spectrum. The reality of cerebrovascular events exists on a wide continuum. Mild TIAs can feel like brief confusion, a strange foggy moment, or slight weakness in one hand that lasts 45 seconds. The person is fully conscious. They may even feel embarrassed bringing it up. It was probably nothing, they tell themselves. A 2019 meta-analysis in The Lancet Neurology found that approximately 40% of patients who presented for stroke care reported having experienced at least one TIA in the preceding 7 days that they had not reported to a healthcare provider, because they thought it was nothing serious. The second myth I want to address: strokes only happen to old people. False. The incidence of stroke in people aged 1845 has increased by 44% over the past 2 decades, according to data from the Global Burden of Disease Study. Hypertension, metabolic syndrome, obesity, sleep apnea, oral contraceptive use in women with migraines, and stimulant drug use have all contributed to this shift. This is not an old person's problem, it's a vascular health problem. And vascular health begins degrading in your 20s if you're not paying attention. Third myth. My blood pressure is fine, so I'm safe. Blood pressure readings are a snapshot. They measure the pressure in your large vessels at one moment in time. They tell you nothing about endothelial function, arterial stiffness, microclot burden, inflammatory cytokine levels, or platelet hyperreactivity, all of which can be profoundly abnormal in someone with a normal blood pressure reading. Your blood pressure number is the weather report. I'm trying to tell you about climate change. This is what you came for. And I want to be clear, this protocol is not a treatment for stroke. If you are experiencing stroke symptoms right now, call the emergency services immediately. This protocol is a physiological support system, a way to optimize vascular health, reduce inflammatory burden, support mitochondrial function, and tone the vagus nerve. It is built entirely from evidence and almost entirely from things you can get at a grocery store. Step 1. The morning endothelial. Reset drink. Take 30 minutes before breakfast. In a glass of warm water, not hot, 40-45 degrees Celsius, comfortable to sip, combine 5 g of L-arginine powder. This is the direct precursor to nitric oxide. It is converted in the endothelial cells by the enzyme nitric oxide synthase into NO, causing vasodilation and reducing platelet adhesion. 1 g of vitamin C powder. Ascorbic acid protects NO from being quenched by free radicals. Without antioxidant support, your body produces NO and immediately destroys it. 500 milliliters of magnesium glycinate. Magnesium deficiency is found in a staggering proportion of people with cardiovascular risk, and it is directly involved in vascular smooth muscle relaxation. The juice of half a fresh lemon adds potassium, supports electrolyte balance, and the citric acid has mild anti-aggregatory effects on platelets. Sip this over 10 minutes. Do not gulp it. This is not a shot. It is a slow vascular infusion. Step 2. Daily omega-3. Loading with your first meal. Take 2 g of EPA+. DHA combined, check the label. This means the actual omega-3 content, not the fish oil capsule weight. EPA in particular has been demonstrated in multiple randomized controlled trials to reduce triglyceride levels, decrease platelet aggregation, and reduce inflammatory cytokine production. The Reduce It trial, published in the New England Journal of Medicine, showed that high-dose EPA supplementation reduced major cardiovascular events by 25% in high-risk patients. This is pharmaceutical-grade evidence for a supplement you can buy at any pharmacy. Step 3. The 4 to 7 to 8. Vagal toning breath cycle. 3 rounds twice per day, morning and before sleep. This is the simplest and most underutilized neurological intervention I know. The vagus nerve is activated by slow, controlled exhalation, specifically when your exhale is significantly longer than your inhale. Inhale through the nose for 4 seconds. Hold for 7 seconds. Exhale completely through the mouth for 8 seconds. Do this 3 times. It takes under 2 minutes. Research from Dr. Stephen Porges' polyvagal theory and subsequent clinical investigations have shown that regular vagal stimulation reduces serum inflammatory markers, lowers resting heart rate and blood pressure, and modulates the HPA stress axis. All of these effects translate to reduced cerebrovascular risk. Step 4. The anti-inflammatory evening. Turmeric protocol, 30 minutes after dinner. Combine in warm, not boiling, milk or plant milk. 1 teaspoon of turmeric powder, containing approximately 200 mg of curcumin. The active compound with potent NF-κB inhibitory effects, meaning it directly suppresses the master switch of inflammatory gene expression. A pinch of black pepper, containing piperine. This single addition increases curcumin bioavailability by up to 2,000% according to research published in Planta Medica. 1 teaspoon of extra virgin olive oil. Curcumin is fat-soluble. Without a fat carrier, very little is absorbed. Drink this warm. This is your evening endothelial care. Step 5. The carotid circulation. Walk 20 minutes every single day, non-negotiable. Walking at a brisk pace, where you can still hold a conversation but feel slightly breathless, produces shear stress on endothelial walls. Shear stress, paradoxically, is one of the most powerful stimuli for nitric oxide production. Your body was designed to move, and it rewards movement by literally oiling its own vascular machinery. 20 minutes. Brisk. Daily. Not 3 times a week when you feel motivated. Daily. The cumulative effect on endothelial function has been demonstrated in multiple studies to be comparable to several classes of blood pressure medication. If you're consuming more than 2,300 milligrams of sodium per day, and if you eat any processed food at all, you almost certainly are, your endothelium is under constant osmotic and inflammatory stress. For every teaspoon of table salt you remove from your diet, replace it with potassium chloride salt, sold as low-sodium salt in most grocery stores. Potassium directly counters the vasoconstrictive effects of sodium and supports the sodium-potassium ATPase pump in vascular smooth muscle. Your blood vessels literally work more efficiently. Sleep is when the glymphatic system, your brain's lymphatic drainage network, which operates almost exclusively during deep sleep, clears metabolic waste products from neural tissue. Beta amyloid, tau proteins, and other neurotoxic byproducts of normal brain metabolism are flushed out during the 7.5 to 9 hours of quality sleep. Poor sleep is not just fatigue. It is toxic waste accumulation inside your brain. Set a consistent sleep time. Keep your room at 18 degrees, the optimal temperature for deep sleep onset. Remove blue light exposure for 60 minutes before bed. If you snore, get evaluated for sleep apnea. It is one of the most underdiagnosed drivers of stroke risk in existence. Let me tell you about a patient I'll call Miriam. Miriam was 54 years old when she came to see me. She was a school administrator, perpetually busy, perpetually stressed. Her blood pressure was borderline. Her GP had mentioned it but said they'd watch it. She drank 2 or 3 glasses of wine most evenings to unwind. She slept 5 to 6 hours a night and functioned on coffee. She came to me not because of a major health event, but because for the past 2 months she kept having these moments. She described them as brain glitches. A few seconds where a word she was looking for just wasn't there. A morning where her right hand felt like it belonged to someone else for about a minute. An episode where she looked at a document she'd written herself and briefly couldn't read it. She'd mentioned these to her doctor. She'd been told she was probably just overworked and should consider stress management. I ordered a carotid Doppler ultrasound. It revealed significant right internal carotid stenosis, a 65% narrowing with a visible unstable plaque. I referred her urgently to a vascular neurologist. She had a TIA evaluation. The assessment confirmed she was in a high-risk window for a major ischemic event. She underwent a carotid endarterectomy to clear the plaque. But what I want to tell you about is what happened in the months after that surgery, because the surgery addressed the symptom, not the system. We rebuilt her vascular lifestyle from the ground up. Morning L-arginine drink. Daily omega-3s. Breathing practice. Evening turmeric. She started walking every morning, 25 minutes before work. She reduced her sodium intake drastically. She addressed her sleep, eventually got a sleep study, was diagnosed with mild sleep apnea, and began CPAP therapy. 8 months later, her endothelial function markers had improved dramatically. Her inflammatory markers were down. Her blood pressure had normalized without medication. And the brain glitches? Gone. Miriam told me at her last appointment, "I feel like someone gave me my brain back." Nobody gave her brain back. She reclaimed it. She just needed to know the map. I want to pause here and ask you something directly. How old are you right now? Drop your age in the comments below. Seriously, I just type your number. Here's why this matters. Stroke risk profiling, vascular age versus chronological age, the specific inflammatory pathways that tend to dominate, the hormonal factors, the metabolic patterns, all of these shift across different decades of life. The protocol I've outlined today is foundational and universally applicable, but I want to create specific, tailored content for different age groups. If you're in your 30s, your concern is different from someone in their 60s. If you're postmenopausal, estrogen's protective vascular effects are gone, and your risk profile changes substantially. If you're in your 40s and carrying extra weight around the abdomen, that visceral fat is its own inflammatory organ. So drop your age. Tell me where you are in life. I read the comments personally and I use them to shape future content. Your comment is not lost in the noise. It genuinely directs what I create next. Let me bring this home. Today, we covered the physiological reality of pre-stroke warning signs, why they happen, what is occurring at the level of the endothelium, the mitochondria, the platelets, and the vagus nerve, and why these signals are so often dismissed, both by patients and by an overwhelmed system that doesn't profit from early warning recognition. Here are your 7 key takeaways from today. 1. Most ischemic strokes are preceded by TIAs, brief episodes of neurological symptoms that self-resolve and are easy to dismiss. They are not nothing. They are alarms. Take them seriously and seek immediate evaluation. 2. Endothelial dysfunction is the root physiological driver of most stroke risk. The health of that single-cell lining inside your blood vessels determines everything downstream. 3. The morning endothelial reset drink. L-arginine, vitamin C, magnesium, lemon. Taken 30 minutes before breakfast supports nitric oxide production and platelet anti-adhesion. 4. 2G of EPA+. DHA omega-3s daily reduces platelet aggregation, triglycerides, and inflammatory cytokines. The clinical evidence is substantial. 5. The 4 to 7 to 8 breathing protocol twice daily tones the vagus nerve, reduces systemic inflammation, and directly supports the neurological regulation of vascular tone. 6. Your sleep is not optional rest. It is active neurological maintenance. Protect your sleep architecture with the same seriousness you'd give to any medication. 7. Move every single day. Sheer stress from brisk walking produces nitric oxide. Your vascular system was designed to be in motion. Stillness is not rest for your arteries, like it is slow decay. The system profits from treatment. I profit from you not needing me anymore. If you've watched this far, you now know what most people will never know until it's too late. You know the whisper before the thunder. You know the signals your body has been trained to ignore. Don't ignore them. Share this with someone you love. Because the most dangerous moment in a stroke is not the second it happens. It's the day before, when the warning arrived and no one recognized it. I'll see you in the next video.